Welcome to the presentation portion of the SOAP note writing workshop. So students have asked me in the past, okay, I can write a note, but I'd like to be able to present since that's where I have to tell the attending what's going on each day. And yes, I think it's a really important skill to know how to present well during third year. And why? It's your main interaction with the attending. Your one major chance each day to be able to demonstrate that you know your patients. It's also you learning how to communicate effectively and efficiently with other medical professionals. And lastly, it's your chance to be able to teach as well. So, how do you go about doing a presentation? Well, first off, we've already been practicing writing a SOAP note. I think when you write your own notes, you're actually able to present in a very organized fashion, and that's a great way to start. Next, you're going to prepare by getting in early or practicing the day before. And I would recommend practicing your presentations all the way through from start to finish without any interruptions. And that way, when you actually do present, you can present and the attending won't interrupt you. If your presentation is really smooth, then your attending oftentimes will let you finish. However, if you start to stumble here or there and you're not sure of yourself, then that's when they're most likely to interrupt. Next up, I would recommend at the end of each of your presentations, you do a quick 5-second teaching point to really demonstrate what you read or what you learned and that you can share it with the rest of the team because they actually are still learning as well. What's really tough about presentations is that different attendings have different expectations and you're always trying to navigate that. However, that's sort of like the rest of your medical career where you're always trying to navigate what your patients are expecting out of you and you're not sure. The best way to go about it is to stay organized through your subjective, objective assessment and plan format and to be complete and thorough. And initially, you'll present a lot more than you need to, but you're eventually going to work towards presenting what's pertinent. I wouldn't really try to emulate the resident's presentation because oftentimes they truncate their presentations because they're really just quickly communicating. However, for you as a student, it's important for you to know how to present properly and organized in a logical manner. Now that you've written out a sample SOAP note, both an H&P SOAP note and a progress note, please go ahead and practice presenting that to one another, to your partner. And let's say it's the morning after you admitted him and you're presenting to your attending. Uh, Go ahead and try to present the H&P to your attending. Please take 5 minutes to do that, and which is oftentimes more than the actual amount of time that you have to give the presentation to one another. Now, if you're still with a partner, I'm going to have the partner now present to you and see how that goes and see if you can follow their story. Now, I'm actually going to go ahead and do an actual presentation as if I was a medical student presenting to an attending. And I'm going to present Mr. S. Mr. S is an 86-year-old male with a history of hypothyroidism and who presents with 1 week history of throat pain. He's been losing his voice over the last month, but really lost it completely over the last 2 months. He was referred by his primary care physician to see ENT, but hasn't seen them yet. He does have right throat neck pain that's been going on for a week. It's a constant 9 out of 10 dull pain that radiates his right ear and nose, and it continues to worsen. He's tried some over the counter medications without any relief, and his pain worsens at night, where it's a little bit more difficult to breathe as he's trying to breathe through his nose. He's had some difficulty swallowing water more than solid foods and has a 40-pound weight loss in the last year, also with a productive cough. He denies any fevers or chills, headaches, no ear or nose discharge, no chest pain, no palpitations. Past medical history does include hypothyroidism since 1954 and sinusitis and a past surgery of appendectomy. He only takes levothyroxine 15 micrograms every day and it has no known drug allergies. No family history is noted. And for social history, he does endorse a 70-pack year smoking history, but is a former smoker, quit 6 to 7 years ago, denies any alcohol intake, denies recreational drugs. He is retired and prayer keeps him going. In terms of vitals, he's afebrile, his heart rate's 100, a rest rate of 20, blood pressure is normal, and his O2 stats are 98% on room air, and he's got a 9 out of 10 pain in his right neck. In general exam, he's in no acute distress, he's a pleasant gentleman, but difficult to hear since he's lost his voice. HENT shows clear tympanic membranes, pupils equally round and reactive to light, extraocular muscles are intact, and no polyps or bleeding on nasal exam. He does have dry mucous membranes and no teeth and no oropharyngeal erythema or exudates. His heart is regular rate and no murmurs. Lungs are clear to oscillation, ballard, no wheezes or crackles. The neck does show some tenderness over his right neck in the submandibular region, and thyroid exam is unremarkable. He has got no lymphadenopathy palpated in the cervical region, In looking directly at the patient, he's got some excessive drooping of the right skin that we noted, which is consistent with some swelling. Labs show a low white blood cell count of 3.2 and a hemoglobin of 8.6. His complete medical panel is essentially unremarkable, and his thyroid studies show elevated TSH at 28.4 and a free thyroxine at 2.6. Imaging shows a chest x-ray where the resident read is no acute cardiopulmonary abnormalities, and he's got a CT neck soft tissue with IV contrast that shows a resident read of no neck tumors, esophageal masses, and his left thyroid gland does contain some punctate calcifications and some chronic sinusitis. So for my assessment, Mr. S is an 86-year-old male, history of hypothyroidism, presents with 1 week history of right throat pain and dysphagia, along with a 2 week history of dysphonia. A differential diagnosis at this time includes a malignancy, given he's got a 40-pound weight loss, 70-pack year smoking history, neck pain, and dysphagia. But it could also be an abscess, given some swelling and subacute onset and some pain, or severe hypothyroidism causing dysphonia, or recurrent laryngeal nerve injury with dysphonia. For my plan, for his right throat pain with dysphonia, it's likely secondary to malignancy, less likely abscess or nerve injury. And I'd like to order a CT neck soft tissue with IV contrast and IV morphine. For his hypothyroidism, he's got a subtherapeutic T4 and elevated TSH. But this doesn't seem to be acute since the patient has been hypothyroid for 50 years. And the hypothyroidism, however, could cause his dysphonia. I'd like to increase his levothyroxine to 25 micrograms a day, get the outside TSH and free T4 values, and get a thyroid ultrasound and fine needle aspiration. For his anemia, it's an unknown cause, possibly secondary to anemia of chronic disease, although he could have some component of occult GI bleed. So I'm going to get some iron studies and like to get outside records for hemoglobin and continue to monitor. For whole person care, patient states that prayer does keep him going through tough times, so I did offer to pray with patient, and he was receptive to that. For fluids, electrolyte nutrition, and prophylaxis, patient will keep him MPO for now, given possible surgical intervention, IV fluids, and heparin for DVT prophylaxis. And lastly, for disposition, I'd like to admit this patient to medicine on duty. My learning point is that severe hypothyroidism can cause some dysphonia in patients. Now that you've heard the presentation, it's actually very similar to what I actually wrote out in terms of my SoapNote H&P. When you present a patient, it really should be like presenting a story. And when you hear a presentation, it really should be like hearing a story as well. If it's logical and organized, you'll know what to do next because of the story that you heard. Now I'm going to have you go back to the presentation that you gave to your partner. I'll have you reflect on that for a moment. What did you notice when you were telling your story? Was it smooth? Did you have any questions? Was there something you were uncertain about? If that happened, it's okay because you're just practicing your presentation. I would go back and try to say, maybe I should be a little bit more confident here. I should probably research the answer here so I can actually give the answer here and go from there. Well, now you've had a chance to practice your presentations, and hopefully the fact that you wrote a SOAP note actually helped you organize how you're going to present a patient. And then hopefully having a time period of approximately 2 minutes for an old patient and 5 minutes for a new patient will help you stay on track as well. Thank you for watching this series of videos. Hopefully it was helpful, and best of luck during third year. If you have a chance, I'd very much like to get your feedback on what I can improve and what went well with this workshop. And if you wouldn't mind clicking the link or using the QR code to fill out a quick survey. Thank you so much. Appreciate it.